How is mesothelioma unique among lung cancers? Imagine a cancer that doesn't start inside the lung tissue itself but on the thin lining that surrounds the lungs and other organs. That's what makes mesothelioma stand out from other lung cancers. Unlike typical lung cancers that develop from the cells within the lungs, mesothelioma originates from the mesothelial cells that from the lining called the pleura. This lining acts like a protective cushion, and when it becomes cancerous, it often begins as small nodules that spread along the lining, eventually forming a sheath-like tumor that encases the lungs or other organs. This growth pattern is quite different from lung tumors, which usually grow as distinct masses within the lung tissue itself. One of the most important differences is the cause. Mesothelioma is strongly linked to asbestos exposure, which is a mineral fiber once widely used in construction and industry. It can take decades, sometimes over 30 years, for mesothelioma to develop after exposure. On the other hand, lung cancer is most often caused by smoking, although exposure to radon gas, air pollution, and genetic factors also play roles. While asbestos exposure can increase the risk of both diseases, it is the primary cause of mesothelioma. The way these cancers grow and spread also sets them apart. Mesothelioma tends to start as small scattered nodules on the lining, gradually merging into a larger, diffuse tumor that surrounds the lungs or other organs. It primarily invades locally, affecting nearby structures like the chest wall or diaphragm. Lung cancer, however, usually forms a well-defined mass inside the lung tissue. It can spread through the lymphatic system to lymph nodes and distant organs such as the brain, bones, or liver more readily than mesothelioma. Histology, or the study of tissue types, further highlights their differences. Mesothelioma has three main types: epithelioid, which generally has a better outlook; sarcomatoid, which tends to be more aggressive; and biphasic, which shows features of both. Lung cancers include non-small cell types like adenocarcinoma and squamous cell carcinoma, and small cell lung cancer, each with their own behaviors and treatment options. When it comes to spreading, mesothelioma usually invades locally and less often spreads through the lymphatic system. Lung cancer, by contrast, often spreads to nearby lymph nodes and distant parts of the body, making it more likely to metastasize early in its course. Symptoms can overlap, with both causing chest pain, cough, fatigue, and weight loss. However, mesothelioma often causes fluid buildup around the lungs, known as pleural effusion, and chest wall pain that can be quite focal. Diagnosing mesothelioma requires careful imaging and biopsy, as its symptoms can mimic other respiratory issues. Its treatment also differs because of its location and growth pattern. Surgery, chemotherapy, and radiation are tailored to target the lining and surrounding tissues. Lung cancer treatments depend on the specific type and stage but often include surgery, chemotherapy, targeted therapies, and immunotherapy. In summary, mesothelioma is unique because it starts in the lining around the lungs, is primarily caused by asbestos, grows diffusely rather than as a solid mass, and spreads mainly through local invasion rather than distant metastasis. Understanding these differences helps doctors diagnose accurately and choose the most effective treatment. If you have concerns about lung health or potential exposure to asbestos, it's always best to consult with a healthcare professional for personalized advice.